This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning. So this is a recent study that came out kind of trying to answer a question. Over the last several years, there's been several studies that have looked at whether vitamin C given IV in sick patients with sepsis is actually helpful. There was an initial study, probably it's been maybe at least 5 years now, that showed dramatic improvement in mortality when patients got IV vitamin C. It was, like an amazing, seemed like a, magic treatment for sepsis, cut mortality in half. Everyone did way better when they got vitamin C, but it was a small trial, wasn't really well done. There's been a couple of bigger trials over the last several years that have shown mixed results. And just this last week, there was a, very large, well-done study. It was published in the New England Journal, and it took ICU patients and randomized them to 4 days of high-dose vitamin C or placebo, and it looked at a endpoint of either death or persistent organ dysfunction at 28 days, and that was defined as either being on dialysis, mechanical ventilation, still needing pressors, so kind of important things. And like I said, there were over 800 patients in several different studies, and it showed that there was actually no benefit at all. The vitamin C patients actually did a little bit worse than the placebo patients in terms of death or kind of persistent organ dysfunction. There were no real safety outcomes, adverse safety outcomes with vitamin C. But I think that this is probably a very good trial, very large, well done, that probably shows that vitamin C is not a kind of magic answer for sepsis, and it probably doesn't really have any benefit, so we probably won't see many more studies. Unfortunately, it seemed like it was too good to be true, and it probably was. Any questions? All right, thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.